Hello and welcome in my channel. Today I gonna talk about the number one antidepressant for treating people who suffering from depression in addition to obsessive compulsive disorder and panic attack. It is called Anafranil. We're gonna talk about Anafranil from all sides: chemical characters, uses, side effects, alternatives, how to minimize side effects, drug-drug interactions, and I will answer the most frequent asking questions. Let's go. Anafranil, active ingredient or active constituent in anafranil called clomipramine. It comes in concentrations 10 milligram, 25 milligram, 27 milligram, the most common three concentrations. In some countries, clomipramine comes in 50 milligram, like here in Egypt, okay? Forms, it comes in four forms: tablet, sustained release capsule, film coated tablet, and capsule, okay? What about T-half? You have to take anafranil each 24 hours. T-half for anafranil, the time in which you have to take the second dose, 24 hours. What about metabolism? It is metabolized mainly by liver, CYP enzymes, three types of CYP. Let's talk about alternatives. In Saudi markets, there is no other alternatives contain the same active ingredient, only anafranil, okay? In Egypt, there are a lot of alternatives. For example, anapramine and sopranil. What about mechanism of action? Anafranil, it is a tricyclic antidepressant. It acts mainly by increasing levels of serotonin and norepinephrine in the brain, okay? But it is tricyclic antidepressant, not selective serotonin reuptake inhibitors or selective serotonin norepinephrine reuptake inhibitors, okay? What about uses? It is used mainly for OCD, persons who are suffering from recurring thoughts or ideas or repetitive things, okay? Number one, the drug of choice for those persons, okay? Also used for depression, also used for panic attacks, and it is used for chronic pain. What about chronic pain? What I mean by chronic pain? Some persons suffering from pain who is not response in any other medications, like lower back pain. For example, lower back pain not responding for any analgesic, for any non-steroidal anti-inflammatory analgesic, for any corticosteroids. The best solution in this case is clomipramine or anafranil, okay? Side effects. Really, clomipramine has a lot of side effects, okay? For CNS, it causes dizziness and drowsiness. And to minimize dizziness and drowsiness, I usually advise anyone to use it before sleeping. By half hour, by 1 hour, okay? GIT problems. Dry mouth is the most common side effect. Dry mouth, nausea, vomiting, diarrhea, and constipation. To minimize dry mouth side effect, I usually advise anyone who is taking already anafranil or clomipramine by chewing gums. Nausea, vomiting, diarrhea, and constipation, I usually advise anyone who uses anafranil to minimize these side effects by using probiotics or apple cider vinegar daily. Probiotics or apple cider vinegar, organic apple cider vinegar daily, okay? On weight, yeah, it increases appetite and also increases weight. It causes high insulin resistance, especially in the belly area. So I advise any person who is taking already anafranil by doing ketogenic diet or intermittent fasting diet. The best to diet to do it with anafranil to avoid overweighting. Okay. Others, the most common other side effect is blurred vision. Okay. To avoid blurred vision, I gonna tell you the best solution in for blurred vision. But here, blurred vision is this compound is completely clomipramine forbidden with patients who are suffering from open angle glaucoma, drug disease interactions. Any person suffering from open angle glaucoma, you have to avoid using clomipramine at all. Okay. Other drug interaction and drug disease interaction with hyperthyroidism, you have to avoid anafranil. With persons who are suffering from suicidal attack, with people who are suffering from manic depression episodes, okay, or bipolar episodes. Other medications, we have to use it with MAO inhibitors. We have to avoid using it with lithium, buspirone, and tramadol. Okay? Let's go to the last part in this video, the most common questions. Number one, doctor, is it effective for delaying ejaculation? Really, it is effective for delaying ejaculation, highly effective for but not the drug of choice. Delaying ejaculation with anafranil is a side effect from clomipramine. So we have to avoid using anafranil as medication for delaying ejaculation. Okay? Who should not take it? Person who should not take it, person who suffering from glaucoma, hyperthyroidism, suicidal attack, manic depression episodes, overweighting, should not take clomipramine. Okay. Is it safe during pregnancy? According to studies, not safe during pregnancy. Okay. Alternatives, doctor, what other alternatives for ejaculation? Other alternatives for delaying ejaculation, other safe alternatives. Number one, tablet called duloxetine. It is approved by FDA for delaying ejaculation, only delaying ejaculation. Okay. Sprays or creams or gel who contain lidocaine or pyrrolocaine. Okay. The two alternatives safe for ejaculations or delaying ejaculations locally, lidocaine or pyrrolocaine, tablet, duloxetine. Okay. Is it safe with antipsychotics? Yeah, it is safe with some antipsychotics, not with all. Okay. The best medication with it in panic attack. In my point of view, if you have panic attack, if you are suffering from panic attack, the best medication is medications which control heartbeats, like bisoprolol, like carvedilol, like propranolol. Okay. How to maintain eye health? To maintain eye health, the best food supplements which contain bilberry extract, which contain zeaxanthin, which contain beta carotene, and which contain vitamin E. In Saudi market, the best supplement at all is Vegan Natura from Magnese company. Vegan Natura. Okay. The last question, can I use alcohol while using clomipramine? It is completely forbidden. Completely forbidden. Why? Because it causes seizure and muscle stiffness, vomiting, blurred vision, and excessive sweating. So we have to avoid use it at all with alcohol. That's all for today. Bye bye for now.